the issue around healthcare. So we're anxious to welcome this morning Dr. Robert Zarr, who represents one of the organizations that was pushing for real healthcare reform, and that is Physicians for a National Health Program.
Thank you to Code Pink for having me out today. I apologize, I don't have a pink tie, so I put on a purple one instead. It is true that I represent Physicians for a National Health Program, which is about a membership organization, about 18,000 physicians around the country. But the truth is that I actually represent a majority opinion when we have 60% of the doctors in this country who support national health insurance. We are gathered here today to review the last 365 days of the Obama administration. I was right here among the crowds exactly 1 year ago, cheering as our country's first African-American president took the highest office in our great country. So where have we come in healthcare? Healthcare reform. As a doctor, a patient, and an American, the first thing I want to tell the president is, this is not healthcare reform. This is a for-profit insurance windfall. The fact that we're hearing nothing from the insurance industry says it all. We simply can't mandate that all Americans buy faulty insurance plans that will leave us vulnerable to medical bankruptcy, while literally giving $500 billion more dollars to the private insurance companies. Private insurance is the problem, not the solution. Second, we must not confuse choice of doctor with choice of insurance plan. Americans want choice of doctors, choice of pharmacies, choice of hospitals. Imagine a healthcare system where we can go to any doctor, any hospital, or any pharmacy without having to worry whether it's out of network. We Americans are tired of insurance plans that deny life-saving treatments to millions of Americans. Third, if we really intend to be able to afford universal, high-quality, lifetime health care for all, we sure as hell will not get there if we allow the inclusion of the most wasteful aspect of this so-called healthcare reform, private insurance. Compare 30% overhead of private insurance to just 3% for Medicare. Mr. President, it's no mystery what the right thing to do is. The solution to finding a universal, quality, and cost-contained healthcare system is right in front of your nose. Medicare, government-financed but privately delivered healthcare. The solution is expand Medicare to everyone. This is not a time to tweak this or tweak that. This is not a time to compromise with members of Congress who display an arrogant disregard for the people's will. This is a time to listen to the voice of the majority of Americans and the majority of doctors who want government-financed, privately delivered care. As a doctor, I see so much needless suffering every day. Mr. President, you have said yourself that if we were to start from scratch, you'd support single-payer, Medicare for all. So let's go back to the drawing board and start from scratch. It's not too late. This is a time for real reform, for real change. You still stand for change for millions of Americans. Don't let us down. Thank you.
Thank you.